Is eyelid surgery limited to fixing extra skin on the eyelid? Eyelid surgery, or blepharoplasty, is used to correct several different problems that might be present in the eyelids. The eyelids are very intricate structures. So they include skin, they have a thin layer of muscle, there's what's called an orbital septum, which is a thin connective tissue membrane that holds back the fat that cushions the eyeball. So there are a lot of different structures, all of them change over time. The one thing that you can notice on pretty much everybody over time is loose skin. Behind that loose skin might be a little thin extra layer of muscle, and if that orbital septum connective tissue thins out, the fat that cushions the eyeball pushes forward and creates bags. So eyelid surgery or blepharoplasty is done to correct any of the problems that might be present to make the eye look much more youthful, smooth out that area, and give it a good contour. Primarily, it reduces the appearance of the loose skin and shadowing that can occur from having bags. But any of those areas can be corrected with essentially the same incision, which on the upper eyelid is a small line that sits in the fold or crease that is a natural skin line. And on the lower eyelid, if an incision is made on the outside, it sits directly under the eyelashes in what is a natural skin crease as well. If you look very carefully at your eyes, you will see a very small line directly underneath the eyelashes, and that's generally where that incision is placed. Some patients, if they only have fullness on the lower eyelids or bags, that can actually be treated by making a small incision on the inside of the eyelid, so there is no external incision. That makes the contour smooth, and that's usually reserved for people who don't have any extra skin on the outside of the eye, because that can't be treated by making an incision on the inside of the eyelid. But otherwise, there are a lot of people who are good candidates for that procedure. That's called a transconjunctival blepharoplasty. The conjunctiva is that layer of lining on the inside of the eyelid, and that's where it gets its name. This is Dr. Kutty, Luxe Plastic Surgery. Please give us a call. Our number is 281-313-0551.